reformulation is at the heart of CAT, cognitive analytic therapy. So in reformulation, we're creating a new way of understanding all the patterns that have been learned as survival but actually lead to things going wrong, creating problems and symptoms. The first stage of the reformulation process is the giving of the psychotherapy file for the patient to look through, and is the beginning of the collaborative process, helping to think around learned relational patterns and cycles.
In the psychotherapy file, we identified 3 kinds of distortions that we name traps, dilemmas, and snags. But actually, when we look deeply to those patterns, traps, dilemmas, and snags, they are also relational. So, to the core of cognitive analytic therapy is the reformulation, the psychotherapy file, and also the relational understanding of those patterns that the patient has learned during his life.
That's lovely, yes. The reformulation also acts as a landmark of how it's been, what persists, and what can be changed, because we're also naming what can be changed, and we're offering ways to help the patient look at the process of change. It's a process where we use patient's own words so that he or she is the driver of their own life, and what are manageable goals for change.
And we name reformulation for various reasons, but one of it is that every patient came to therapy with his or her own formulation about what is happening to him or her. During this initial phase, with the therapists in a collaborative way, both reformulate the problems that has not been resolved by the patient, and we try to co-create a new understanding that is written in the reformulation.
Yes, and perhaps the last point is that it's a very active model. The reformulation is co-created with the patient in whatever form and using whatever language the patient can manage and tolerate, and setting manageable goals for change.
The reformulation must include which are the goals we are trying to achieve in therapy. In some way, the reformulation is the map that the therapist and the patient use for the active phase of therapy. So everything in the active phase of therapy must be referred to the reformulation and to the relational patterns that has been identified.
Perhaps one last thing to say, that this creative way of reformulating someone's chronically endured suffering is sometimes the first time that they've been heard in a way that makes sense of why they've had to do what they've had to do. So it's a hopeful practice of reformulating.
It's not only a cognitive understanding of the problems. The reformulation letter must be emotional, must touch the deep emotions of the patient, and the patient must feel that has been understood by the therapist.
Yes.